I'm Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you being here today from across the country. We are honored to be joined by physicians in Iowa, Kansas, and Virginia. We'll be sharing how their members of Congress, who are also healthcare providers, have impacted healthcare for their constituents, and who will be calling on them to fix the healthcare crisis they helped create. Before I begin, I want to please note that these physicians speaking today are doing so as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers or other affiliated groups. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include any employment information or other affiliations unless they expressly share those. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Balanoff.
Good afternoon. My name is Krista Balanoff, and I'm a surgeon in the state of Kansas. And today I'm joined by physicians across the country who are speaking out against our members of Congress who are also healthcare providers for further breaking our healthcare system and doing nothing to fix it. Members of Congress are in recess right now, campaigning, vacationing, instead of working to address the healthcare crisis in our nation. Some of them, like those representing us on this call, contributed to that healthcare crisis. And we believe it's important for our fellow constituents to remember that. Like my U.S. Senator Roger Marshall, I took an oath to care for patients. Senator Marshall is a physician, an OB/GYN. He knows what it means when a patient delays care because it cannot afford it, or at least he should. He knows that losing health insurance can mean skipping medications, putting off a needed procedure, and waiting until a manageable problem becomes a medical emergency, or at least he should. He knows that 2/3 of the hospital in Kansas are critical access hospitals, that 80% of these hospitals are operating at a loss, and that 1/3 of these hospitals are at risk of immediate closure, or at least he should. He knows that Kansas lacks even one safety net hospital to help people who don't have adequate health insurance receive at least some level of care, or again, he should. And that is why his votes are so hard to reconcile with his prior profession. Senator Marshall voted for H.R. 1, the law that makes deep cuts to Medicaid and erects new barriers between Americans and the care that they need. The American College of Obstetricians and Gynecologists warned that provisions in the law will make it harder for people to maintain their coverage. But Senator Marshall, an OB/GYN, voted for it anyway. Then, when Congress had the opportunity to preserve the Enhanced Affordable Care Act premium tax credits that help millions of Americans afford health insurance, Senator Marshall again voted against extending them. Instead of protecting affordable coverage, he supported allowing those tax credits to disappear. Now, Kansans are suffering. Thousands have already been forced off of their health care due to the cost, and as many as 60,000 could be forced off in total. At a moment when families are confronting higher health care costs and the consequences of these decisions are becoming more clear, Senator Marshall should be working to fix the problem. A physician in the United States Senate should be leading the effort to expand access to care, not taking a victory lap on policies that make coverage harder to afford and harder to keep. Senator Marshall himself defended H.R. 1 by claiming Republicans were preserving, protecting, and strengthening Medicaid. What an affront to patients. When the Medicaid cuts that Senator Marshall supported take full effect next year, more Kansans will go without care. Many already need to travel to Kansas City or to other states for tertiary care. If the local health facility closes, they may be forced to travel a great distance for primary and preventative care as well, if they can afford to do so. Otherwise, they'll simply go without. Already, I've treated patients who've had inadequate health care insurance. They're either uninsured or underinsured, and they've had to ask me which treatments they could opt out of in order to save money. Nobody living with cancer or other diseases should have to ask for those sorts of questions. Our healthcare system was already broken, but Senator Marshall voted to make it worse. Kansas deserves a senator who uses his medical training to fight for access to care, not someone who spends recess campaigning while Kansans are left living with the consequences of his votes. Thank you. I'd now like to introduce Dr. Kettlecamp to speak.
Thank you, Dr. Balanoff. I'm Dr. Kettlecamp. I am a retired internist from Iowa City, Iowa. My Congresswoman, Representative Miller-Meeks, is a physician. She has repeatedly invoked her medical background when talking about health policy. She's even described herself as bringing a physician's perspective to Congress. But physician's perspective should begin with one fundamental question: what is best for the patient? And if Representative Miller-Meeks had followed that principle, I do not believe she would have justified the vote she has given. Like Senator Marshall in Kansas, Representative Miller-Meeks voted for H.R. 1, the Republican law that cuts federal Medicaid spending and creates new barriers to maintaining health coverage. She then voted against extending the Affordable Care Act tax subsidies that so many people depend upon to afford their health insurance. In Iowa's first congressional district alone, it's estimated that almost 13,000 people could lose Medicaid coverage due to the Medicaid cuts that Representative Miller-Meeks helped pass. Another 8,600 could lose Affordable Care Act coverage because members of Congress, like ours, voted against extending the tax credits. For those keeping score at home, that's more than 21,500 people in our part of Iowa that could lose their health care coverage, in part because of Representative Mariannette Miller-Meeks. These are not just statistics. These people are our neighbors. They are patients in Iowa City and Dubuque and Davenport. They're patients in rural communities and small towns throughout the district. They are people who have to delay care because the people that they elected to represent them chose to make health insurance less accessible. Representative Miller-Meeks cannot say that she did not understand the stakes. She is a physician. She knows that prevention is better than waiting for a crisis. She knows that patients with chronic diseases do better when they can consistently access care and medications. She knows that rural communities cannot afford to lose more patients from the insurance rolls while hospitals and clinics face growing financial pressure. Iowans should judge their elected officials by what they do, not by what they say. And the record is clear. Representative Miller-Meeks voted to slash Medicaid funding, and she voted against extending the ACA tax credits that help people afford coverage. This recess, instead of simply campaigning, Representative Miller-Meeks should be working to repair the damage that those votes have caused. As physicians, our job is to help people get the care they need. It's time for Representative Miller-Meeks to start applying that same principle to her work in Congress. And beyond the individual cruelty of taking people's health care away from them, H.R. 1 is destroying rural Iowa. In many cases, the hospital or multi-specialty clinic is the biggest employer in town. When those institutions are shuttered, it results in all kinds of downstream effects. First, the gift shops and artisans leave, then the restaurants and hardware stores close, and finally the local Casey's shuts off its gas pumps and moves to the nearest interstate exit. I've witnessed this hollowing out of many small Iowa towns in the past. It started as small farmers lost their farms to corporate producers. Now the same thing is happening to rural healthcare. The net effect is bad Republican health policy, which is basically less health care for all, becomes bad Republican economic policy. Now I'd like to introduce Dr. Suraman to speak.
Thank you so much, Dr. Kettlecamp. My name is Dr. Natasha Sriraman. I'm a pediatrician in Norfolk, Virginia. Like my colleagues have said so beautifully on this call, my member of Congress, Representative Jen Kiggans, is also a healthcare provider. She worked as a nurse practitioner and is a veteran before she came to Congress. So when she votes on whether Americans can afford health insurance, she should understand that these are simply not abstract policy debates. These are about real patients, the patients that we see every day in our office. They're about the person who waits to refill a prescription because the cost is too high, the parent who puts off taking their child to their doctor, or the patient who goes without prevention until a health problem becomes an emergency. I cannot tell you how many times I hear from patients that they could not afford the asthma pump, and instead of worrying about that, the child ends up in the emergency room with an asthma attack. Not only does this have undue burden to our families, this actually increases healthcare costs across the board. And this is why Ms. Kiggans' healthcare record is so alarming. She voted for H.R. 1, legislation that actually cuts federal Medicaid spending and creates new barriers to coverage. And let's be clear about what Medicaid is. It's healthcare for our most vulnerable neighbors, their children, mothers, veterans, low-income seniors, and people with disabilities. Many of these people who Ms. Kiggans took care of her in her very office and says that she advocates for. In our district, Virginia 2, it's estimated that over 11,000 people could lose their health care because of the Medicaid cuts Representative Kiggans supported. Again, as Dr. Kettlecamp said, we're already seeing this in rural Virginia. Many hospitals are closing down because of these cuts. In one part of the state, women have to drive over 50 to 60 miles to get OB care and or to get there in time for a delivery. 50 to 60 miles. The American Academy of Pediatrics also has spoken about H.R. 1 and talks about that due to its sweeping cuts to healthcare and nutrition assistance programs, that will inadvertently harm children. If you thought maybe these people could just buy coverage on the ACA marketplace, think again. Because Representative Kiggans also voted against extending the Enhanced Affordable Care Act premium tax credits that help millions of Americans afford health care insurance. That means Representative Kiggans has now voted in ways that threaten coverage from two directions. One, cutting Medicaid, and two, refusing to protect the ACA tax credits that help make private insurance more affordable. And what makes this particularly frustrating is that Representative Kiggans should really know better. She has cared for patients. She has worked in healthcare. She should understand that insurance coverage is not a luxury. Healthcare is what allows people to see us, doctors, healthcare providers, fill a prescription, manage a chronic illness, and get care before it becomes a crisis. So what should a healthcare provider do when families are facing a healthcare affordability crisis? I believe the answer is simple. You should be working to expand access. You should be at the negotiating table trying to protect coverage. You should be looking for ways to lower patients' costs. And instead, during this congressional recess, you should be listening to the people who are worried about whether they'll still be able to afford health insurance. But instead, Representative Kiggans has helped create this crisis and is now spending her time campaigning. She's not available to her constituents, not available through town halls. This is not the leadership Virginia families need from someone who once took care of patients, many of them her own vulnerable patients. Being a healthcare provider should mean something when you vote on healthcare. It should mean standing with patients and protecting their access to care, not voting to take that care away and heading home to campaign while your constituents deal with the consequences. Thank you.
Thank you so much, Dr. Sriram, Dr. Kettlecamp, and Dr. Balanoff. We'll now open it up for questions. If you have a question for one or any or all of the physicians, you are welcome to raise your hand and I can allow you to unmute, or you can type your question in the Q&A or the chat box and I can help read those aloud for the physicians. So we'll allow a moment for folks to be able to type their questions or raise their hands. I have a question for Dr. Kettlecamp, looks like. In a recent ad, Congresswoman Miller-Meeks told Bigger Insurance to, quote, bring it on. But this election cycle, she's gotten over $500,000 in health industry PAC money. What do you make of her campaign claim to be holding insurance companies accountable?
Well, this is consistent with the just disingenuousness we've seen from her and her party for some time. Yeah, you can look up who her contributors are on opensecrets.org and draw your own conclusions on, who's funding her campaign and who she's working for. But yeah, I think this is one of the things that I myself and my friends and family find the most offensive is that they're making claims that just simply aren't true. And again, this is why I say we need to look at what they're doing, not what they're saying, because what they're saying is meaningless.
Absolutely. Thank you. There's a question in the Q&A for Dr. Balanoff. In Kansas, many hospitals are on the verge of closure. How do you think recent changes on the federal level are affecting those hospitals? Are we seeing higher uncompensated care levels for hospitals because of ACA premium changes?
Yeah, I agree. We have a lot of hospitals in our rural state that are on the verge of closure. They're losing providers. They are shutting doors because they can't afford to keep them open anymore. And those patients are suffering. Similar to what everybody else has said, patients are traveling a long distance for care, and it's not just that specialized tertiary care that they're needing. A lot of the 50% of, I think, the hospitals in Kansas and the rural hospitals don't have ICU care. So if there's any need for ICU care, those patients are also having to be shipped out, which again causes additional burden on the community and on the family and on the patient themselves to not be able to get care close to home. So with all of these reimbursements decreasing, all of the support for the hospitals decreasing is causing a serious health crisis, especially for our rural states and patients.
Thank you, Dr. Balanoff, and thanks for that question, Morgan. See if there's any follow-up questions. A question for Dr. Sri Raman in the chat now. Rep Kiggans has been meeting with rural hospital leaders to try to convey her commitment to supporting them. Do you think that that sort of action is helpful?
Again, I think I'm going to follow what Dr. Kettlecamp said, see what their actions are versus their words. We do have, funds coming through the rural kind of grants and things like that, but it does nothing to cover the costs of losing these hospitals. Some of them go to various projects, I don't know if they're earmarked ahead of time, but it's a very small drop in the bucket. And maybe that's just to kind of show good faith. I don't know. But, having these conversations, that's not going to bring back these rural hospitals. That's not going to, someone who had a family member in an ICU 5 hours away, it's absolutely horrific. I'm married to an ICU doc, and just, imagining that you would have to be away for your care in such a, state of illness and away from your family, and not to even mention the impact on the family, but also jobs. And again, all those downstream effects, I don't think people are taking into account. And again, for any of us who have been pregnant or had children, to drive 50 to 60 miles to get to labor and delivery, it's, that's not a good thing. And I think, we're going to be paying for it later down the road. I mean, just, for me to see a child with an ear infection or an asthma flare in the hospital, in my clinic, is probably 1/5 the cost of when this child comes into the ER in status asthmaticus. So again, we're actually not saving in the long term. And again, she can speak to these rural hospitals, but again, actions speak louder than words.
Absolutely. There is another question in the chat from Amber. In my rural Kansas community, our LTC closed a couple of years ago. The hospital has communicated with locals that the OB department will likely be next. When the OB department is what carries the facility financially, what happens next? Is there anything before closure that can be done by the community to keep its doors open? And what is your advice as a physician to patients who are afraid to lose their hospital?
I think that is the kind of the crux of what we're looking at here as our system is breaking more and more. It's the patients and the communities that are suffering. And I think the big thing is making sure that the community keeps engaged with their lawmakers, and let them know this is what we need and this is what we're seeing, and keeping that line of discourse open. And I agree that words are not what we should hang our hats on. We need to be actionable, and we need to see that action. Because we do see people who are not able to get that care anymore. And again, it's those downstream effects of what this one act is doing that's going to have the most impact on everybody.
Thank you. Thanks for that question, Amber. I had one more question chatted to me. I put it in the chat. How do you reconcile the fact that these healthcare providers are also mostly anti-abortion? That's for any of you.
As someone who takes care of teenagers and college-aged patients, the best deterrent against abortion is accessible and affordable birth control. And I think that's something we have to keep in mind. There are statistics, there's data. Colorado is doing a great job about this. So again, saying one thing but not having access to another. And there are differences based on socioeconomic status, language barriers, racial barriers in terms of access to care. And again, time and time again, we know that access to affordable, reliable birth control is actually, lowers the numbers of abortion.
Thank you, and thanks for that question. I am not seeing any other questions at this time, so we'll go ahead and conclude today's call. Thank you again to all of the media who joined across the country. It's great to have you all here. And thank you so much to our physician advocates, Dr. Balanoff, Dr. Kettlecamp, and Dr. Sri Raman. We appreciate your time and your advocacy on behalf of your patients across the country. So thank you and have a good afternoon.
Thank
Thank
you.
you.
Thank you.